Doctors, nurses keep fleeing Nigeria under Buhari regime. Health Minister, welcome to the news, and please subscribe to our channel. As a sacrifice, I want to encourage them to stay back and help to revitalize the health sector, the Junior Health Minister stated. The Minister of State for Health, Joseph Ekoman-Kama, on Monday reiterated President Muhammadu Buhari's regime to address the brain drain in Nigeria. The greatest challenge facing the sector presently is the doctors and nurses leaving the country, but I want to rather encourage them to stay back, seeing the efforts the government is putting, the minister said. Mr. Ekoman-Kama, who spoke with journalists while inaugurating projects at the Federal Medical Center in Butemeta, Lagos, identified brain drain as the major health sector challenge. We can attest to it that the government in the last 3 years has raised 100% of the budget for the health sector, Mr. Ekoman-Kama stressed. The project inaugurated by the minister included the Orthopedic and Trauma Center, Molecular Building Complex, and Oxygen Gas Plant. Others are the Clinical Training Center, Powerhouse, and Ultramodern Theater. The minister added, as a sacrifice, I want to encourage them to stay back and help us revitalize the health sector. And we have witnessed that today with what is on ground in this hospital. The minister commended Adedamola Dada, the hospital medical director, for judiciously using available resources to provide further infrastructures and services rendered to patients. If you do not go around this hospital, you won't know that they have such facilities, and this is because they have been able to utilize the available resources from the government judiciously. If people are aware of the infrastructures here and the quality hence, they would not need to travel abroad for medical tourism, he stated. I scored them a 100% with what I have seen so far, and the reward for hard work is more hard work, so I expect more from them. Now, if you've listened to the other news where the Minister of Health, I think the Senior Minister of Health, came out and addressed these people, you would laugh out your lungs, because he said that, as the people are traveling, that they're replacing them. I'm like, And the person will be saying, no, what thing they do. This junior one now don't come say, there's going to be brain drain. Brain drain in the sense you lack experienced hands. Just imagine that a doctor who came out, who passed everything, and he has stayed for 1 year, 2 years, 3 years, 4 years. He has experience. He has gone from the stage of looking to the stage of carrying out treatments, giving out treatments. If not, one will be surgeon. He has gone from the stage of looking. He's now one of the best. Imagine make your best doctors just they leave, and you are saying, if they leave now, that was what I was like. Who do us this thing? Where they from see these people they put for commissioner, being a minister of health by? I was like, now I'm not saying now person talk. Now person talk. When these people are supposed to be giving back to the economy, in fact, now they're supposed to give back to the country. Now these people will come, take our whatever resources now they have gained from us, and they'll go on elsewhere. Why? Not of their own making, but because now we fuck up. Now we mess up. We don't encourage these people enough. When you hear about, they're even threatening to go on in the industrial strike, just imagine. They're threatening to go on industrial strike. Why? What they promised them since 2021, December 2021, that they're going to be giving them. I think that they went for an industrial. They went for strike. I think for quite some time, And I was asking myself, this thing is not okay. Then the government quick tell them, say they no worry, say then go pay them. Up till date, they have not started paying them that money, and this is like we are at almost at the end of the 8th month. It doesn't make sense. It doesn't make sense at all. I just hope nurses fleeing from Nigeria to other countries will not boomerang on our health sector. Nigeria slummed under the All Progressive Administration sector. My dear, these people, the thing is, these people in government, most of them that are aged, they don't even know their right from their left. Look at what that man I told you said, the senior minister. I think the minister, because they said this one is the junior minister. If you see what the senior minister said, he said for everyone that leave, they will have one to replace them. I'm like, what's this one saying? If you cannot export commodity, we should be able to export what we have. that is skills and services. What we need to do as a country is to continue to train people to meet both local and foreign needs. Now, wow. They are right. Our politicians seek medical attention overseas, so our doctors and nurses will still be waiting for them there. You cannot run away from a shadow. Can you imagine? My dear, now, when I heard what the other doctor said in other news here, because I will keep saying this because it's related to this particular news. I said, at the end of the day, save gone. At the end of the day, they're not even talking about how to even fix the situation. What is making these so-called nurses and doctors want to leave their country of, residence? What do you want make them leave their work? What do you want? They're not looking at asking questions or finding out or even improving whatever that is making these people want to leave. But rather, they are like, if they go now, they will replace them. And I'm like, now wow. I was really surprised when I heard it, and I was like, who does this kind of thing? Alright, I beg, there is still a lot of them on ground that don't have meaningful jobs, so the government should just do the needful by employing. Yes, they should do the needful by employing. Who is going to train those ones? Who is going to train those ones? Who is going to train those ones? That is the thing. Kenyamo and Lai will say this is a plus for the government. At least they make a way for people to travel. I'm telling you, there is nothing that they will not use as an advantage. Why won't they? Buhari has crumbled this country. They train themselves in school, therefore they have the right to move into any country that will pay them better. Of course. Had it been the country was better, would they have wanted? Imagine had it been Nigeria had been Dubai, or Nigeria had been the United States that take care of this kind of their workers. Do you think that these people would travel? Of course not. You will have to put a knife over their throat for them to. But this one, they're not paid well. They're not working in a conducive environment. There is nothing that challenges them to do better. You get environment where you go work, where we say, even if they're not paying you what you want to be paid for, but they challenge you to be better. At least it will even make you say, okay, let me stay. But coming out to say these people should consider, I don't think they are going to consider. People will jump by if they see space. So why? Because the governments have not been doing the needful. All right. Yes, that is how it is. That is exactly how it is going to look like. And when these people come out finish, who will come and train those ones that are going to be here? To start afresh, to start getting the experience, and no. APC will happen to all people who want to vote for them. All right, on this note, you've come to the end of the news. We'll say thank you.